Hi, I'm Brandon, a physical therapist at Heartland Orthopedic Specialists, a department of Douglas County Hospital. Today we're going to be covering approved exercises for our total hip and total knee joint replacement camps. These exercises are important for helping regain strength, range of motion, and reducing symptoms prior to surgery, and will help speed up the recovery process after the surgery. If at any point doing these exercises produce sharp, shooting, stabbing pains, please stop doing the exercise and consult a physician or a physical therapist if needed. Now we're going to slide both heels up towards the buttocks, making about a 90-degree bend in the knees. We want to keep the feet about shoulder width apart. For this, there are 3 hand placements that we're going to talk about. The first one is the easiest, and that's where the arms are down at the side by the hips. The next is with the elbows bent. And then the third would be crossing the arms over the chest. Now you have no support from your hands or your elbows to assist with the exercise. We'll bring the arms down towards the side. Make sure that you tighten up your core by drawing your belly button down towards your spine using your lower abdominal muscles. Lift the hips up towards the ceiling, squeezing your buttocks. Hold for 5 seconds. And after the 5 seconds, then you can relax and repeat. As a progression to the bridge exercise, what we're going to be doing here now is a bridge with leg extension. We're going to bring the feet close together. The hands are down in the easiest position next to the hips. We're going to keep that core nice and tight again. Bridge up, squeezing the buns. Now we're going to kick out his left leg, which is going to be the non-surgical leg. Hold for 5 seconds, and then bring that back down, and then rest. Now as we do this, and we'll come back up again, and kick the leg out. Again, the right leg is the surgical leg, keeping the core nice and tight. You want to make sure that you keep your hips level. Try not to let the one hip drop as you kick the leg out. For the mini squat, we're going to be standing next to a counter, kitchen sink, something that's going to be nice and sturdy to help with balance. The feet should be shoulder width apart with your toes pointing just slightly out to the side. We're going to squat down now partially, sticking the buttocks out as if you were going to be sitting into a chair, keeping the knees above the toes. We want to make sure that the knees do not go out in front of your toes. You want to make sure that you have good posture, so again, chest up, shoulders back as we do this exercise, and looking up and out in front of you, promoting good cervical posture. Keep your weight symmetrical between the left and the right leg as you go up and down. For the forward step up, we're going to be standing on the floor just in front of the first step. We're going to step up with the surgical foot. We're going to shift the weight forward and push straight up, driving off of that surgical leg, tightening your thighs and your glutes as you push up. From here, we'll pause for a second and then slowly lower yourself down in a controlled manner back down to the floor again. And push up, driving off of that leg. Holding your balance, maintaining that for a second, and then slowly lowering yourself back down to the floor. Now for the lateral step up, it's going to be very similar to the forward step up, except for now we've turned sideways. We want the surgical leg right in front of the first step. We're going to step up sideways, again shifting your weight onto that leg and driving straight up, tightening your thighs and your butt muscles, holding, and then coming back down. As you drive up and you hold this, again, try and balance for at least a second count and then control the descent down rather than just dropping to the floor. For this exercise here, we're going to be balancing on one leg. We're going to be balancing on the surgical leg. What we want to do is we want to pick up the non-surgical leg and have that just hovering above the ground versus driving it way up. Just in case you would lose your balance, it's right there to protect you and gain your balance back again. We want to make sure again that we keep the belt line level throughout the exercise. We're going to balance for 30 seconds. As far as the hand placement goes, you can start off using both hands on that sturdy object, the kitchen counter, the kitchen sink, something like that. Then progress to where just your fingertips are on the counter, then to one hand, and then eventually to no hands. When you do the no hands, we want to keep the hands hovering above the table, again, just in case you would lose your balance. Here, we're going to make sure that the blue band is stationed again on a solid object or in a door. We're going to put this behind the surgical foot around the ankle. Sitting in a chair, again up nice and tall with good posture, chest up, shoulders back. From here, we're going to pull the heel back as far as what you're comfortable. Pause for a second. And then release in a controlled manner. We don't want you to just let it fling back. Control the band throughout the entire exercise, and then repeat.